My name is Becky Sanders. I am the Program Director for the Upper Midwest Telehealth Resource Center. And today my colleague Allie Orwig will be joining us as we talk about broadband for consumers. Also behind the scenes, Carolyn Miller is with us, and she's going to handle any technical details, and we'll send out the slide deck and all that good stuff after our time together today. So with our virtual office hours, we usually do those a couple times a month, and these are just half-hour sessions. We try and make them really relaxed and interactive as possible. We do have some slides we're going to share, so I'll start with that, and then Allie will jump in, and then we'll kind of tag team at the end. If you have any questions, please put them in the chat, and you can unmute yourself to ask questions. Like I said, I want to be very interactive here today and very casual. Okay, I'm going to share my screen. All right, so today we're talking about broadband resources for consumers. And there is another program that is just launching that you might have heard about, the FCC's COVID-19 version 2 program, and Allie can talk about that, but we're not really going to focus on that. We're going to really talking about patients, end users, consumers, individuals, and making sure they have access to broadband today. So I can't start any presentation without mentioning the 4 states that we cover for the Upper Midwest Telehealth Resource Center, which are these lilac states of Illinois, Indiana, Michigan, and Ohio. And as you'll see on the map, we are one of 12 telehealth resource centers across the country. There also are 2 national centers, one for technology and one for policy. The Telehealth Resource Center program is funded by HRSA under the Federal Office of Rural Health Policy and the Office for Advancement of Telehealth. And the program itself has been around since 2006, and we have been a Telehealth Resource Center since 2011. The 14 of us call ourselves the National Consortium of Telehealth Resource Centers, and we do have one website that links back to all of the 14 different individual TRCs, and we host monthly webinars and post fact sheets and other information that is helpful. Here at the UMTRC, I like to consider us virtual librarians, especially with COVID and everything going virtual. So many of our resources are located on our website and available to the public for download. We do a lot of connections between programs to learn best practices. And then here's a pretty comprehensive list of our presentations and trainings. So we have our webinar series. A virtual view is our new podcast series that we've started during the COVID-19 pandemic. Our virtual office hours we're doing today. We have telehealth workshops. And towards the end of the summer, we hope to open up our training and demo center as numbers continue to fall and it gets easier to congregate even with masks. So I'm going to hand things over to Allie.
So probably everybody on this call, I don't need to do a deep dive into why broadband is so important in rural. You probably all have at least some understanding. This is on the left side here, a brief list of things that are very, very impacted by access to broadband connections in rural. Of course, we know work from home over the course of the last year has become huge. Education as well, all the kiddos doing e-learning and the online sessions. But you know, that can also be things for adults as well, getting your advanced degrees online without ever having to step foot on a campus. The other 2 low-hanging fruit items here are entertainment and shopping. I mean, we all know Netflix, Hulu, Amazon Prime, very much a part of the everyday life of a rural resident now. But what some people don't think about when it comes to shopping is it may be an actual lifeline for folks that don't have reliable transportation, or even if you do have transportation, the local grocery or Walmart may still be a 40-mile drive one way. So it really can be much more than just a convenience for folks in rural. And then the two that maybe have really popped up in the last few years, and especially with COVID this last year, would be agriculture and religion. Religion, I know a ton of people's church services have gone online in light of COVID. And the example I like to use is my husband and I have a niece that we haven't actually been able to meet yet. She lives in Wisconsin, but we were able to watch her christening. So that was pretty cool to be able to participate in that. And then precision agriculture, and I know I've jumped around a lot here, but precision agriculture is basically integral for a working farm at this point in a rural area. That's things like precise application of pesticides or watering through use of drones, self-steering or guided steering tractors and combines. All of this is predicated on having a workable broadband or satellite connection. And then for the purposes of our conversation today, healthcare. I break them out into telehealth and telemedicine. Lots of different places have their own specific definitions, but the way I talk about telehealth, it's much more broad. It can be like your Fitbit that you wear to monitor your fitness. You can take fitness classes online now. Monitoring weight or your glucose, things like that, can really help people that don't have easy access to their primary care provider. It can be things like using EHR between hospitals and clinics. Just those electronic health records are considered telehealth. And then something even as simple as getting health tips on your cell phone can be considered telehealth. And another personal example is I've got a little girl, and whenever she was born, the hospital gave me a thing you could sign up for that they'd send you little reminders and, time to brush your teeth with a fun little video for her and things like that. So all of that can be wrapped up into telehealth and a lot more that I've not mentioned here. And then the much more specific telemedicine, where you are actually providing medical care. That can be things like a telestroke program where you were able to be online with a specialist in a larger area to decide whether to the TPA medications that can stop strokes, things like that. So the actual provision of medical care is what comes down to telemedicine, and then the big umbrella of telehealth, which covers all of that and more. I don't know if I have control. Okay, Becky's got control. So what are some barriers in rural to getting those broadband high-speed connections? Obviously, geography, location. And this can be something like being located a great distance from the nearest fiber connection, or it can be something as simple as being located where there's a high tree line or down in a valley that prevents you from connecting to a satellite or a wireless connection. So there's a lot of different things that go into this. And if you're near a river or located near train tracks where there's right-of-way issues for getting those connections built to you. Then there's also the problem of places that have access, but maybe not enough or not reliable enough access. So places where there's only one provider and it's cost prohibitive to pay for a 100 meg connection. Maybe the best your provider can do for you is a 10 or 15 meg connection. And then of course, reliability. If you have lots of dropped services or just unreliable connections, can make work and life very difficult. And then, of course, I sort of already mentioned the cost, but strictly the cost to construct fiber is between $25,000 and $40,000 per mile. And that's one of the biggest barriers to getting those extremely reliable high-speed connections into rural areas, and certainly a barrier to getting fiber to houses, individual dwellings. Very difficult for companies to get a return on their investment if they were going to do anything like that. And there's some really interesting alternatives that have been tried here recently, and I think some of them are very promising. Working with local REMCs to put fiber on telephone poles really cuts down on the cost and right-of-way issues. I've heard of a couple pilot programs that are using blimps in the north part of the state to do a wireless connection for a large area. It works better in a flatter area, of course, but just a lot of really neat programs that are trying to get around this. Next slide. So how can we help you help yourself when it comes to cost for health care individuals and healthcare entities? There are several programs, and we've listed a few of them here that are from the FCC. There are programs outside the FCC that we'll touch on, but these are probably the biggest programs within the FCC to help you get funding. So there's the telecom program, which is for both telecom and voice services. That can be wireless or wired, so a cell phone or a actual landline, both eligible. And the I'm talking about the I've already went forward to Lifeline. The reimbursement rate for telecom program is based on the urban-rural differential, so that can change a little bit. They were putting together a database that's been put on hold for the time being, that urban-rural rate differential. Then Lifeline, which I accidentally jumped forward to in my mind, is for end users. It's not actually for the healthcare provider, it's for the families at the end to support either a wired or wireless telecommunication device. So that's where it could be a cell phone or a landline. And that is $9.25 a month, or on tribal lands, it is $34.25 a month. But you have to be at or below 135% of the poverty line, or you have to be a participant in some of the other income-based programs like SNAP, Medicaid, things of that nature. So then we also have in here the EBB, which we're going to talk about a little bit more but just in a nutshell, it's the Lifeline program on steroids. It's much more funding. It covers a couple different things. But we've got some slides to get deeper into that. E-rate is a program specifically for schools and libraries. It's very similar to the Healthcare Connect Fund I'll talk about in a minute. But it is for, again, the telecom services, and then it can be anywhere from a 20 to 90% discount off your costs associated with getting that broadband connection. So it can be an extremely beneficial program. And it's based on the number of kids in poverty. So you can think about the number of or percentage of free and reduced lunch kids in your local schools. That's what determines how much of a reimbursement you get. Then there's the Connected Care Pilot Program. It was announced it was late summer, early fall. If you're not already enrolled, you missed your chance because it is a pilot program and you had to be approved during that first window, but it's $100 million over the course of 3 years. It's 85% reimbursement, and the whole point of the Connected Care Pilot Program is to connect to those end users, to connect your healthcare facility to the patients. But it is not able to be used for devices or medical equipment. I believe the first round of awardees were announced January 15th. And since you cover the 4 states that you mentioned, Becky, there was only one in our 4-state area that received any funding, and that was OCHIN, OHCHIN. They have some CMHCs in Cincinnati, so and across the country, but those were the only ones that were funded in Ohio. I do think there will be another round of pilot program applications accepted, but I don't have a date on that yet. The COVID-19 funding is one that we've gotten a lot of questions about lately through UMTRC and ITN. It is $250 million. It's just like the first round of COVID-19 funding. However, we've got a lot more information than we had on the first round of funding. The first round of COVID-19 telehealth funding was stated as first come, first serve, but there were also some different sentences and language in that said the money would be directed to hardest hit areas or areas where the money would have the most impact. So it was really unclear how they were handling that. During the second round, they've given a full scoring rubric. So it's much more clear what they're looking for in terms of what they want to fund. However, the big drawback is you only have 7 days to apply. The window opened today. So if you have not yet applied, and you want to, you need to get on it right now. You have until May 6th, so literally 7 days from today, to apply for this funding. So extremely tight timetable there. And then lastly is the Healthcare Connect Fund. That's why I work in a lot with the Indiana Telehealth Network. It is up to 65% off your costs associated with construction, installation, and monthly recurring charges for broadband and high-speed internet. It is very similar to E-rate, except there's a fixed percentage, and it is specifically for nonprofit healthcare entities. If you are applying on your own, you must be rural. If you are applying as part of a consortium, you have to be part of a consortium that is at least 51% rural. So, and just about any nonprofit healthcare entity is eligible, though there are some restrictions. Critical access hospitals, nonprofit hospitals, FQHCs, CMHCs, CHCs, RHCs, and skilled nursing facilities, all eligible. So that's the Healthcare Connect Fund in a nutshell. And I think now, Becky, we're going to talk a little bit more about the EBB. Is that correct? Yes.
Yes, that is correct. Do you want to start off, or do you want me to?
Sure, I can talk about some of the basics. So for the EBB, I told you it's just like Lifeline, it's just on steroids. So instead of that $9.25 or $34.25 tribal, you actually are eligible for $50 a month or $75 a month if you're in a tribal area. And there's also a one-time allowance of $100 to purchase a device. So a phone, an iPad, something like that. Obviously, it's not going to cover the entire cost of a desktop or a tablet or pretty much anything, but they wanted to provide some incentive for people to get the device if they needed it, but not so much funding that people would be tempted to resell it and keep the money, or not take care of the device as well as they might have. So that's the reason that it is kind of a low amount, but it's still substantial for a lot of people. So that's the basic general premise. And Becky's got the front page up here where you can see a little bit more information. But again, it's for that end user. It's for the families, not necessarily the healthcare providers or anything like that, at or below 135% of the poverty line or enrolled in SNAP, Medicaid, etc.
Correct. So what I've got on this slide here is just the basic website where you can go to get more information. And this is just a screenshot. What's on that main page, if you scroll down, and here, these qualifications, the eligibility is very, very similar to what Allie mentioned before for the Lifeline program. So here's your 135% below the federal poverty guidelines or participation in SNAP or Medicaid, Lifeline. But some of these are different. This one here, receiving benefits from free and reduced lunch, is not part of the Lifeline program. A federal Pell Grant is not part of the Lifeline program. And this experiencing a substantial loss of income is not part of the normal Lifeline program. So that's, why it's more expanded. There are, and these hot links, if you go to the link on the previous slide, give you information to FAQs and what providers are participating. And that is what I've put here is some of the eligibility. And again, here's your link, and we'll send these slides out so that you have access to those links.
And then, Becky, if you can pop back just one slide, I do just want to point out, when you go through these criteria that you meet one of the criteria below, I want to point out that next to last bullet point, experienced a substantial loss of income due to job loss or furlough. Just take a look real quickly, everybody, at the income levels. If anybody in your household or the household of the person you're talking to lost a job or took a pay cut of any kind, the salary amounts there, the net income amounts are fairly high, almost $200,000 for joint filers or almost $100,000 for single filers. So a lot of people that may not be able to access Lifeline or SNAP or Medicaid or ever have even been close to those things could be eligible for this program if there was any kind of job loss or wage loss during the COVID, since February 29th of 2020. So just
Right.
really want to point that out because it's very high. It's a very
It
high
is.
threshold.
It is. Well, and thanks, Allie. So we're talking about this today, but this, and I think it says it here, no, maybe it doesn't. The program, they've announced, like released the order from the FCC, but it's not open yet. They have not said when it's going to open. I think there was a comment period that ends like on May 5th or something like that. So I'm expecting it to be sometime in May. But I've been on a couple of webinars for this one, and they weren't clear yet how they were going to double check if somebody had received a Pell Grant and how that application process is going to work, and checking of the databases to check income levels and those types of things, because it is different from the existing program. So,
And I suspect that it will probably come out sometime. I mean, we're approaching tax day rather quickly, but I suspect it will come out sometime after taxes have been filed for the previous year for 2020, because they'll want to check that income specifically.
yeah, that's true. Yeah, that's a really good point. All right, so here's some of the eligibility and all that information. We're not going to go through too much of that today, but they do have this available on their website. And what I wanted to get to was, so you're in one, a specific state. We've probably got people from multiple states on the call here. So when you go to check and see, am I eligible and who is offering this service? So you have to hook up with a telecommunications provider for either fixed or mobile broadband services. So you go and click on your state, and I'm in Indiana, so I just use this as a sample. And if we want to, we can go out on the live website and look at other states. But what I was kind of dismayed about was that if I don't have a device in my household, that there's only 1, 2, 3, and I think, well, there's more down lower on the list for Indiana. I didn't get them all, but there's not a lot of companies offering devices. So what this program has to do is those providers have to figure out what can they put together for a laptop or a desktop or a tablet that the retail price is $100, so that the consumer only has to spend $10 to get it through the benefits of the program, but it's really only, and they get $90 back, the vendor does. So yeah, I guess that's all I wanted to say about that. Allie, do you want anything you want to add?
No, I would just encourage everybody to look at your state's list and see if there's any major providers that are missing, just so you'll be able to kind of preemptively answer questions for your constituents.
Mm-hmm. Right. Well, and then some of these are only mobile. So Access Wireless would only offer discounts on a cell phone. AT&T is doing fixed or mobile, so that could be house internet or a mobile phone. Now, if we go back to that very first slide, something else to point out is this is per household. So you could have four people living in your house. Only one of them is going to be eligible for a mobile device, unless you choose to have it for, internet for the house. Enrollment options. This is from a slide that we grabbed during a training session. So here's the information as you talk to your patients, consumers that you work with, is 3 different options for them. Once this program opens, is have them connect the broadband provider directly, go to getemergencybroadband.org, or mail in an application with your eligibility. And this is contact information for Allie and I. But I want to open it up. We're almost to the end of our time today, but I do want to open it up for questions. And you can feel free to unmute yourself and ask a question or put something in the chat. Also, because we are a federally funded program, I'm going to ask Carolyn to go ahead and put a survey link into the chat. It's just a short couple of questions to fill out for us to get your feedback on the usefulness of this program and any ideas for future programs that you'd like us to do.
Hey, Becky and Ellie, this is Dan. A lot of good stuff in there. I did not know that there were some programs offering to purchase devices or a credit for a device, which I think is huge, especially for the elderly Medicare population. I don't want to kind of get off on get off topic here, but another thing that has come to my attention locally is this is not obviously not federally funded, but have you guys heard of Starlink? So
yeah, Elon Musk, he's going to take us to Mars and get us all on the internet.
I know, right? Yeah, and he's going to do it all in a Tesla. But that's something, because where I live in West Central Indiana, obviously internet options are very limited. So I have family members who are hopping on this opportunity. They don't have it yet, but it's something to kind of keep out there. And this would probably not be for something for families who, would qualify for SNAP or Medicaid or anything like that, because it is pretty substantial upfront cost. But there are other people in rural areas who might be able to benefit from it. So again, so yeah, thank you for all that.
Yeah, you're welcome. I don't know, is HughesNet still around? There have been several satellite internet providers.
It is, but frankly, it's not workable in most areas. It's not a reliable or cost-effective option for most end users in the experience I have had with them.
Yeah. Well, this was years back when we cut the cord with DirecTV. You know, we looked at a DirecTV satellite internet and that kind of stuff. But...
Say what, honey?
That would be a waste.
What's that? Yeah.
All right. Any other comments or questions before we end for the day? Absolutely, Debbie. Feel free to share this with your practices. I got to send this, I have to send the slides to Carolyn so that she can send them out to you. So you should have those in the next couple of days. All right. Well, thank you everyone for joining us today. And it feels like Friday to me, I guess, because I have an all-day meeting tomorrow. Have a good weekend.